Good evening, everyone. Thank you so much for attending our webinar this evening. We're very excited to bring this webinar. We've titled it In Sync, but it's regarding therapy resources to help children who are struggling. And we have quite an expert group with us tonight in a whole bunch of different areas. So I'm going to do some introductions and then we will get started. Please note also, if you have questions, you can certainly send them in, and at the end we will go through some housekeeping things for you as well. So we first of all, with TheraPlay, we have Katie Marino. She is a physical therapist, doctor of PT, and she's been working at TheraPlay since 2007.
Long time.
Crazy. And has experience working in inpatient acute care, outpatient orthopedics, and experience with manual therapy. And she currently is overseeing clinically half of our 14 outpatient centers. So Katie's going to talk to us about physical therapy, occupational therapy, speech therapy, and feeding therapy. And then we also have Mr. Jerry O'Leary with MusicWorks. Jerry has been a longtime friend of ours, and we've been partners in helping patients together. He founded MusicWorks to provide music therapy services to children and adults with challenges. Dedicated the past 20 years, wow, Jerry, searching for miracles to help people in need. He trains staff and he music therapist and delivers music therapy services at the MusicWorks in Havertown and the Hatboro centers. Whether it's at a community center, an adult daycare, a special needs school, a religious community, or assisted living, Mr. Jerry, as I first met him, has touched his client lives through music. Graduated from St. Joe's, where my daughter graduated from, and earned his master's degree in music therapy from Immaculata. And then last but certainly not least, we have Miss Selena, who is an art psychotherapist with Child and Family Art Therapy Center. Selena's board certified registered art therapist and a licensed professional counselor with a master's degree in art therapy from Drexel University. While studying at Drexel, Selena completed an internship at CHOP, where she provided art therapy to children on an inpatient rehabilitation unit. She's an experienced child and adolescent art therapist, having worked in a range of inpatient and outpatient settings. So I'm really excited to have all three of our experts attending tonight to talk a little bit more about services, so that you can figure out what might be some of these services that might help your children. And the beauty of this is that we all work together. So if you're thinking that music therapy might work and occupational therapy might work, then we can all work together to help your child realize their goals. So I'm going to turn it over now to our experts. And Katie, if you want to take it away.
All righty, sounds good. All right, so at TheraPlay and at all of our family of companies, we offer all the different disciplines. So for physical therapy, which is obviously my love, what we really look at is the development of gross motor skills, strength, balance, and really just kind of assessing the body from like a musculoskeletal perspective. So we work with children with known genetic abnormalities to sports injuries to whichever might occur. We also, everything is focused on an individualized plan. So when I evaluate a child, I'm truly looking just at that child and seeing what their impairments and needs are and what motivates them. So why am I making the goals that I'm making? So that, again, do I have a soccer player? Do I have a kid who really isn't into sports, but really just needs to be able to play on the playground with their peers? So everything is very individualized to the child and the family's needs. So we will utilize so many different things. A lot of it, just common things that we tend to see would be endurance training, modalities. So we would use electrical stim if we had issues with neuromuscular re-education. We would use kinesiology taping if we were working on alignment or activation of certain muscles. We have ultrasound machines, and then really just kind of we have orthotics that we'll utilize. So depending on the child's foot position or if they need a splint for their hand, really kind of making sure that we're putting them in an optimal position so that they can then do the items that we ask them to do. Same thing, we will work with different vendors. There's different things out there like Theratogs and Spios and different devices that we can place the child in that go underneath their clothes where they can then function and do everything independently. And so it's a great opportunity that way. We do a lot of stretching. So being in a pediatric outpatient environment, I'm sorry, that's my doorbell going off. We will utilize a lot of stretching with our torticollis babies because that tends to be the most common thing that we see. So what that is would just basically be that a baby after they're born has significant tightness in their neck, and then we have to work on improving that and improving strength so that we can get solid postural control and we don't have any additional issues. And our big focus is home exercise programs. So teaching the families and the children how to do different activities that's only going to help assist and progress their progress. That is probably the most crucial thing that we do, because when a family brings their child to us, we're the ones teaching them then how to help their child and how to incorporate all the things that we do in the hour that we have them. We then are able to teach the family and the child so that they can then do it at home and get better so much faster. So some of the common conditions that we treat, I mean, you can see the whole list here, but we do see a lot of kids with brachial plexus injuries, which is a nerve injury that occurs during birth, where during the birthing process, when the child's coming out, it does rip part of the nerves from the spinal cord. Cerebral palsy, which most people are familiar with, but which would be a neurological condition that occurs during or shortly after birth, where the child then has neurological symptoms, which can vary. We do treat common pain syndrome, also known as amplified musculoskeletal or pain syndrome. So where they have had an injury and there's no reason as to why they're having this significant amount of pain, and we work to retrain their brain and their nervous system to not be in a constant state of pain. We work with concussions, improving coordination. Developmental delays is also a very common thing that we see, where a child might come to us at any age and just be slightly behind their peers. So, you know, maybe they're a delayed walker, or they can't jump or run as fast as their friends. They have trouble going up and down the stairs. That's when they would come and seek out physical therapy. Joint instability. So these are the kids with incredibly loose joints. So the prime example would be a child with Down syndrome, but you do see a lot of kids who have Ehlers-Danlos, who they're just incredibly hypermobile, and we then struggle to make sure that we maintain the safety of their joints. We see orthopedic injuries, a lot of post-fracture care, scoliosis, Sever's disease, which would be where basically where the Achilles tendon inserts in the heel starts to pull away, and it will kind of have like little micro tears in there, which can be extremely painful. And it's more common between like 10 and 12 years old. We see sprains and strains, torticollis, which I kind of already described, which is a very common diagnosis that we see. Toe walking is another one. So toe walking is also, it kind of goes back and forth between physical and occupational therapy, because depending on the nature of why they're toe walking, it could be that they truly are just tight, and then that would come to me, but there could be a sensory component where they would need both physical and occupational therapy. And then tone, which is referring to muscle tone, and that can be a confusing term, but what that basically means is how quickly your muscles can activate and do what they're supposed to do. So when we go to move and everything is normal, thinking about somebody who has higher tone, like they tend to be tighter and they will not be able to, they'll move quickly, but then not have the same stability with the movement. And then somebody who's got lower tone has to work 10 times harder because they have to work significantly to get those muscle contractions. So for occupational therapy, it's more centered around the patient's motivation to engage in a meaningful activity of life. So I always think of a child, their job is to go to school, is to play. And so that is really what you'll see in occupational therapy. So they are the ones that will get in there and teach them how to hold a pencil properly, do different fine motor tasks such as like button up a shirt, get dressed, brush their teeth, wash their hands. They will focus on a lot of that. But the other big part for occupational therapy is also identifying, can they motor plan through what they have to do? Do they have the appropriate regulation as far as their sensory system? Do they need to have some squeezes beforehand or joint compressions in order for their muscles to work and be able to do that? They do a lot of social emotional stuff and working on coping skills. So if you have a child who has a hard time transitioning between activities or going from the car to a different place, like that is where they will utilize a ton of different techniques to help make those transitions easier. Occupational therapy, I truly kind of believe is the glue that holds all the rest of us together, because they really look at all the other things. And yes, it looks like they're just painting and drawing with markers and doing this, but there's so many different pieces that play into what they do that it's truly amazing to see how well all of us work together. So they will also do the same thing. So their evaluations will consist of standardized tests, parent interview, but also we have different like parent tests that they can look at to really identify where those root causes are. Because again, we see kids in an outpatient setting where I always think about when I send my kids to school, they're so good. And the teachers always say how great they are. So when they come to us, we are prepared for that. So we know that they are going to listen to us better than they listen to mom and dad, or they might try harder, but that might not really be what we're seeing. So we try to get a true representation of that so that we can help the family, because a family that's called us for an evaluation, they're calling us for a reason, whether it's to make sure that everything's okay or that they need the help. It's our job to really dive in from every single angle and find out what we can do to make this child and family's life the best and easiest that it can be. And then even with occupational therapy, like there are ones where they do consistently reassess, because a child can do something one session and not another. So again, as all disciplines do, we really do assess the child every week to make sure that we're truly meeting our goals and have an appropriate updated plan of care. And so a lot of the diagnoses that they see, so you'll kind of see there's a lot more neurological things on here. So you've got your ADD, so they will work to help them come up with coping strategies in order to manage that. Autism, we do see, I mean, I can speak for TheraPlace specifically, we see a lot of kids that are on the spectrum, and it's all ends of it. Developmental delays, so same kind of thing. They could be delayed in fine motor skills. They could have issues with their grasp or not being able to, again, play on the playground, but for different reasons. Emotional regulation is a big upcoming thing. We're teaching kids how to cope. We have different programs that we use that it's really easy for the kids to understand. So the one we use right now is Incredible Flexible Me, and it has different characters. So we have Rock Brain for the child who can't get past a certain thing and has to have something a certain way. And then there's Glass Man for the one who maybe gets a little bit too aggravated with different things and goes to break things. So we have all of this to put it in their terms so that they can truly understand, okay, I'm being Rock Man right now. This is what I need to do to calm myself down so that I can then be the best me that I can be. Executive functioning. So that is basically the thought process through why you do things. So if you're planning through, okay, I'm going to take a shower. How do I have to do this? Or I have to plan out my week of schoolwork and I don't know where to begin and I don't know how to organize a calendar. This would assist with that. Feeding. So the occupational therapists focus more on the sensory component of feeding. So these are kids who can't stand certain textures in their mouth. They typically tend to have had a lot of reflux, so they tend to throw up quite a bit. They don't like messy play. So an occupational therapy feeding session, if you ever have a chance to watch one, are amazing to watch because they literally will be covering their hands with applesauce and they'll work on like licking, kissing, touching the food, holding the food in their mouth for a couple of seconds and then allowing them to spit it out, to just work on having them accept different foods. But yes, I always go back to the one feeding session I observed with one of our therapists, Sandy, and the child would not do any messy play and would not tolerate like applesauce or anything like that. And so she let the child spread applesauce all over her face, all over her, just to show him that it wasn't scary. And after that, he was like, okay, if you can do it, I can do it. And he ate. And it was amazing to see. And she was then able to allow their family's dinner time, lunchtime routine to be so much less stressful. So it is typically, and we'll talk about feeding as well with like the speech and occupational, because typically it does involve both, because you don't know what came first. So the sensory issues come first, and then the oral motor piece came second, or vice versa. Sensory processing challenges. So that is definitely a more common and accepted term right now, where basically a child's sensory system is not regulated. So typically with like premature kids, they tend to be at a heightened response and they need more input. So these are the kids who they'll flap, they'll need big bear hugs, they'll tend to be the ones wiggling in their seats, where the family's just like, I just need them to sit still. We will work with these families to get all of those tools in place so that they can not be standing out to their peers because they're, like I said, flapping or falling out of their chair. School and social struggles. So this is a big one. Again, it kind of goes along with the emotional regulation, but we work to teach kids how to have conversations. Pre-COVID, we were offering social skills groups where we would have kids of the same age range kind of doing the same thing. And it was nice because we taught them how to communicate with each other, which is so important. And honestly, I think even through all that we're going through now, that socialization piece is huge. And just the Zoom calls and the go-to meetings and everything, we're still working to teach our kids how to communicate with other people. And then visual processing deficits, they also work on vestibular, but so they will work on their ability to coordinate the movement of their eyes. So that's important for reading, copying from the board. Are they getting headaches because their eyes aren't working together and one eye, is slightly drifted in and the other one is not? And then the vestibular deficits, which isn't on here, would be more of the balance and proprioception. So how does the brain perceive where the body is in space? And then for speech therapy, so really speech therapy it's a very big thing as well. So you can look at kids with articulation issues, which is basically how they formulate words and how they sound. But the bigger piece is the expressive and receptive language. So a lot of kids will come to us and they can't always say what they want to say, which would be the expressive component. But then we also look at, can they understand what's being said to them, which is the receptive. And most kids that do come for speech therapy have a combination of an expressive and receptive language delay. They will also work on like social and cognitive communication. We do AAC devices, which would be for children who cannot communicate, and giving them like an iPad or another device where they can then communicate. And then feeding and swallowing difficulties. So the difference there would be more, they're going to work on how does their tongue move? How does their jaw move? Can they swallow safely without aspirating into their lung and putting them at risk for pneumonia? So they have more of the structural part, whereas the occupational therapists, like I said, have more like that sensory and can we take all these new textures? So they will use a ton of different methods. So they will use like different breathing management, they will use visual demonstration. And so now how we get around that, because we do have kids coming into the office, is we do have face shields and we have desk shields so that the therapist can be behind and pull down their mask, model what the mouth is supposed to look like during certain sounds, put it back up so that the child can then see that visualization as well. They'll use continuous phonation, reducing rates of speech. So we will get kids who are super fast talkers, as I'm one of those people. So if I'm going too fast, you can just wave them down and I will slow down. But just helping them with that. So that can also reduce stuttering. It can improve fluency, where then the child can communicate better because they've slowed down and aren't making those mistakes. And then I kind of briefly talked about, but there's the augmentative and alternative communication devices. So we will either use the devices itself, or we use what's called PECS, which is a picture exchange system, where they would carry around a binder and be able to show pictures of what they are trying to do. And honestly, I think a lot of behaviors stem from when kids can't communicate. And so once we give that piece to them, all of a sudden you start to see those behaviors disappear. And so some of the common conditions would be, like I said, the receptive expressive language disorder, apraxia, which is the difficulty to formulate a word. So when they're trying to talk, they tend to be very hard to understand because they mix up their letters and the way that their mouth works with their brain just doesn't coordinate. Articulation struggles, so that could be that they have trouble with the letter R, the letter S, and kind of, I always describe it as like a lisp. There's like a lisp could be a good example of an articulation issue. Speech delays due to hearing loss. So we do work with a lot of kids who have hearing loss or have had cochlear implants. So we do extremely aggressive therapy with those children. There's the feeding with the oral motor difficulties. And just because a child doesn't have issues with feeding doesn't mean that some of the speech issues aren't coming from the oral motor component. So they will do a lot of stuff in assessing how their mouth moves and how everything goes. The pragmatics of speech, which is like the conversation and being able to formulate sentences, and then connecting the nonverbal children with communication devices so that they can then in turn communicate with others. And then we have feeding therapy. So again, this is something that I think is such a gray area. And so when we get that first phone call, my child has feeding difficulties, we ask so many questions. So is it the oral motor piece where their tongue isn't working in conjunction with their mouth, they don't have strong jaw, that their teeth are, they have like, where they have to cut it, a tongue tie. Sorry, I just lost my train of thought there. Fine motor delays. So again, this would be where like the occupational therapist would step in. Like, is it that they can't pick up food and bring food to their mouth? Are they not able to use the utensils? And so then they're avoiding it. Are they picky eaters with a limited food repertoire? We had a feeding patient who would not eat anything that was the color brown, like, which, you know, a lot of good things are brown. Chocolate's brown, brownies are brown, like, you know, so we had to work on that. A lot of kids with reflux and allergies or no appetite. So a lot of them, it's called interoception, where they don't recognize, their body doesn't tell them when they're hungry. So if they're not taught how to feel that and understand that, they will become failure to thrive. Again, then there's the distraction while trying to eat. So helping with that mealtime routine and giving the family strategies and kind of setting the boundaries for the child during mealtime, and then struggling with positioning. So that's another thing where either the occupational therapist, or they might even call me in as a physical therapist, they might not be aligned properly to safely eat. So do we need a special feeding chair so that when they're sitting, they can't then lean back and then aspirate the food? So there's lots of different components that go into the feeding therapy. And it can be, and I'm always very honest with families when they ask me about it, it can be a very long road because it's a behavior that has to be retaught. But it is typically extremely successful. And the way in which we do it at TheraPlay is all through play-based. It's not the sit here and you're going to eat and not get up until you do it. We make it as fun as we possibly can be, which is a great thing to be able to see because we don't want mealtime to be something that's negative. If a child is experiencing any of this, any of these symptoms, then the medical team would be contacted. So a lot of the times we do communicate very closely with the doctor. If there's frequent vomiting, if there's chronic constipation and diarrhea, difficulty latching onto the breast bottle, or coordinating the suck swallow reflex, the breastfeeding has definitely become something we've become more involved in because there are so many oral motor pieces that the lactation consultants, like, we work hand in hand, but may not be able to assist with. If there's issues with chewing or advancing textures, lack of self-feeding, the coughing, choking, gagging, or retching. So then again, is it maybe that they're undiagnosed for reflux, that they have something that's inhibiting their swallowing, and we would then refer out for a swallow study just to make sure that they were safe. If they eat less than 20 different foods, that is something that you would refer to feeding therapy for because they should have more than that in their repertoire. And if there's a significant aversion to certain foods or avoidance behaviors at mealtime, which I think we kind of I touched on quite a bit. All right. Thank you for listening to me.
Thank you, Katie. Thank you, everybody, for tuning in tonight. My name is Jerry O'Leary. I'm the director of music therapy for MusicWorks, and I've been a practicing music therapist for the past 20 years. It was a dream of mine that I finally found as my second career, and it's something I absolutely love to do. And the biggest question I ever get is, what is music therapy? So just so everybody understands what it's all about, I'm going to give you the definition from the American Music Therapy Association, which is our national organization. And basically, music therapy is the clinical and evidence-based use of music interventions to accomplish an individualized goal within a therapeutic relationship by a credentialed professional who has completed an approved music therapy program. So basically, it's a music therapist using music to complete a goal or to set a goal for someone. At MusicWorks, we founded MusicWorks back in 2002. I spent the first 2 years of my career teaching in a school, and at that school, everybody was Mr. this or Miss that or Mr. this or Mr. that. and I became Mr. Jerry, and 20 years later, it stuck. So the reason we founded MusicWorks was to provide music therapy services to individuals with challenges. And we started out working with children, as I said, my first 2 years, then we worked with adults for a while. And now MusicWorks treats kids from 1 to 99. And I consider everybody from 1 to 99 to be a kid, because we all have a kid in our heart. The services that we provide small group music therapy sessions in our Havertown and Hatboro treatment centers. We have sessions for adults. We do sessions for seniors in their homes. We do adult daycare centers, assisted living facilities, in-community living arrangements through different organizations like CADES, LifePath, Elwyn, Kencrest, Horizon House, Divine Providence, Don Guanella, and Aristocare, to name a few. Out in the community, we provide our services to special needs schools as well. There's Overbrook School for the Blind in West Philadelphia. We've worked with them since about 2006. Our Lady of Confidence is a special needs school sponsored by the Archdiocese of Philadelphia, as well as St. Catherine's School. They have both elementary levels and high schools. And we also do a lot of work in public schools throughout Delaware County at the present time. In July of 2011, MusicWorks opened our first music therapy treatment center in Havertown. Prior to that, we used to rent community spaces in different areas, go out into the community and try to reach out that way. We decided to consolidate in 2011. We found a beautiful spot here right off the Blue Route in Westchester Pike in Havertown. And then many of our clients were traveling down from Montgomery County, coming down the Blue Route. And there was a need to go up into Montgomery County and find another spot. And we were very, very lucky that on St. Patrick's Day, March 17, 2017, I'll never forget it, we found the spot which is now MusicWorks in Hatboro, which we opened in September of 2017. So the small groups, it's up to 6 children per session, accompanied by a parent or a caregiver. Now, that was pre-COVID. Right now, this week is the first week we're actually getting back to in-person sessions. We've been doing telehealth sessions for the past 6 months, but actually clients are coming back to both centers. And the class sizes are a little bit smaller, as you can imagine, because some people are a little bit concerned about going out in public still and in the groups situations. The nice thing about MusicWorks is our groups are very small, so you're not running into groups of 25, 50, 100 people at a time. We work with children and young adults that suffer from autism, Down syndrome, cerebral palsy, developmental delays, and genetic abnormalities, many of these which Katie talked about. We facilitate sessions to high-functioning groups for those with ADHD, ADD, bipolar disease, anxiety, depression, and mood disorders. And there's a lot of, I'm trying to think of the term, there's a new term now, can't think of it off the top of my head, but because of COVID and because of all the changes we're going through, people are having a lot of difficulties and a lot of emotional issues are appearing. And we're trying to help them with music as well. We target goals at improving learning and communication, focus and attention, finding gross motor skills, and socialization within the group, all through a music environment, music format. Now, each of our clients will attend a pre-placement assessment, and that gives us an opportunity to sit down one-on-one and go through a typical session with them. And in that typical session, we can see what their abilities are and try to place them in the best group we have available for them. We'll usually offer the parent the first offering is usually the best group, and if they can't make that, we'll offer a second group or a third group. We really try to say that if you can take the first group and that time works for you, that's going to be the best for your child. About 63% of the children we work with at MusicWorks are on the autism spectrum. That was up to about 79% many, many years ago. But over the years, we have branched out into other different challenges for people. Statistics from the CDC released in 2016 say that 1 in 54 children is diagnosed with autism spectrum disorder. And that is a huge increase than the first CDC report of 2002, where it was 1 in 150 children. A lot of that increase isn't the fact that there's more of it, but clinicians and therapists are more able to identify the signals of ASD and help parents find it at earlier ages, which we're finding as well. And the source of this all is from the CDC. Now, at MusicWorks, how do we help out? Well, we were the first music therapy service provider to secure medical assistance for children up to the age of 21. So we can go from 1 to 21 providing music therapy services on a weekly basis for children. We're the only MA providers for those that reside in Delaware, Bucks, and Montgomery counties. And MusicWorks also is a nonprofit organization. So as a nonprofit, we raise funds to provide financial assistance for people who either don't have medical assistance or their insurance doesn't cover music therapy, which we find in a lot of cases, or they're low income and they have issues about just putting food on the table. So we're concerned about making sure that the therapy gets to those who need it. And a lot of times too, once 21 comes, medical assistance stops. However, the challenges of life don't. So from 21 on up, we provide our financial assistance piece to help kids from 21 to 99. We really do. How's the best way to obtain a music therapy service for your child? What we basically do is we do a verbal intake. You call in the MusicWorks, you do a verbal intake over the telephone, probably with Miss Lori or one of our intake coordinators. And after we gather some basic information, we'll schedule an assessment, which is that pre-placement assessment. There's no charge for the pre-placement assessment. In fact, medical assistance for music therapy, there's no co-pays. Medical assistance covers all the charges for music therapy. Then what we do is we try to obtain the most recent psychological evaluation or individual education plan to get a better understanding, besides just that 30 minutes work together in an assessment, about what's going on, with this child or with this client, and set up some specific goals we want to work with the parents on, and get agreement from the parents and ask the parents if they have any goals besides what we're looking at. Most of the goals we work on are socialization goals, learning goals, motor skill goals, things like that. For people who are covered by Magellan, we are required to get a written diagnosis with specific challenges that can be covered by Magellan through MA. And Magellan will approve 26 units of service over 6 months. So that's 26 30-minute sessions for 6 months. And we basically have a 3 treatment cycle set up for most Magellan clients who follow music therapy and make progress. I thank you for your time. And here comes Selena.
Thank you, Jerry. Hi, everyone. Thank you so much for joining us tonight. So my name is Selena D'Onofrio. I am a board certified art therapist as well as a licensed professional counselor. I work at the Child and Family Art Therapy Center, which I will talk a little bit about. But first, let's talk about what is art therapy. And I appreciate Jerry also asking that about music therapy, because a lot of times people might not know what it exactly entails. And so what I like to tell people is that I am a regular therapist, but with a secret weapon. I have art in my back pocket. And so this can be really great for kids that might not want to participate in talk therapy alone. And so what I like to do is use art and play to help the child, feel more at ease. And it also opens up another mode of communication. So art therapy is done by a master's level clinician with a degree in art therapy. And the art making can really be the focus of the therapeutic process, meaning that there will probably be talking throughout the therapeutic process, but art is really more of the focus in the creative process. There's a lot of nonverbal communication that can be done through art and play. And a lot of times children, especially young children, might not always have the words to put to their experience or how they're feeling. And especially right now in this very difficult time for all of us, a lot of adults don't always have the words to put, to how they're feeling. And so you can only imagine how, our kiddos feel. And art therapy also can help to decrease defense mechanisms. Maybe a child is really avoidant of talking about their feelings. Maybe a child, says, no, I'm fine, but then maybe has these epic meltdowns or outbursts. So kind of getting to the art can help to decrease those defenses to kind of help get those stuck feelings out and also help get to more of the root of the problem and how they're feeling. Art therapy also helps us to uncover unconscious imagery. Sometimes, things might not always be able to be said in words. There might not be words to put to how you're feeling. And so having art to kind of help us to go another avenue if, words are just not what the child wants to communicate, this can be really helpful. And there's a production of a tangible product. So it's something they can feel proud of, something they can take home, and something that can be useful. My favorite project is a calm down jar. And so that is useful, but also fun to make. And it just kind of helps to teach kids about meditation and being mindful, but also a really fun project to do in session. And I didn't mention this, but I have been practicing in the field for about 6 years. And I've been with the Child and Family Art Therapy Center for about a little over a year. So you can move to the next slide. Thank you. So who are we? Who is the Child and Family Art Therapy Center? We are a network of art therapists. We are a private practice of all art therapists, but we are also all licensed professional counselors. So that means we went through additional training and education to get that credential. We provide treatment for children, adolescents, and we are just about to launch an adult program for art therapy. So we're really excited about that. And anyone that comes to see us could be facing a variety of challenges, meltdowns and anger, depression, sadness, anxiety. Maybe they have an ADHD diagnosis. It could be parents could be going through a separation or divorce, family, changes, trauma, grief and loss. That's just to kind of scratch the surface. And especially right now, you might be seeing, an increase in your child's, big feelings or behaviors and things like that. And art therapy can be a really great way to kind of help them express those things that, again, they might not be able to put words to right now. We have 4 locations. So we are located in Center City, Haverford, Paoli, and Plymouth Meeting. And right now I am working out of the Paoli and Plymouth Meeting offices. Currently, we are offering services through telehealth. We use Zoom primarily. We will make exceptions to see children in person if there is kind of like a crisis, if you have a much younger child that would not be able to sit through a telehealth session. And we are going to continue to monitor that so that we can return to the office in person safely and, with all the proper precautions in place. Okay. So what services do we offer? We offer individual child therapy, and for ages 4 to 12, we really include that parent support. We really want the parents to be involved in therapy. We want them to be in the know about what we're doing in therapy, while also, respecting the child's confidentiality. But we want the parent to kind of know what we're kind of talking about, what they're learning, and kind of what skills are being implemented, so that they can, then use those skills at home and help to carry out the work throughout the week. We also do art therapy and play therapy, as I said, especially with the younger kids, there's a lot of play therapy involved. And then we also offer individual art therapy to adolescents, ages 13 to 19. And as I said, we are now launching the adult program, which will be up to, as old as 99, like Jerry said. We can support adults up to any age. So with this individual art therapy component, we do have an assessment process as well. If you wanted to kind of get your child started in therapy, we have an initial parent meeting with the parents only, and then we do a family art therapy assessment, which is always very fun to see family dynamics, how the child fits into the family, all of the family's great strengths, and then maybe also some challenges that arise. And if you're having a child that's having a lot of sibling issues, that could also be really great to kind of see how a child interacts with their siblings and vice versa. And then the third assessment session is an individual art therapy assessment that we do with the child individually so that we can kind of assess, you know, where we're starting from, current level of coping, functioning, all of that good stuff. We provide a lot of parent support and training. Like I said, you know, we try to include parents in session, especially for younger kids, just at the start of session, not the whole session. But then we'll also provide support outside of session. We will oftentimes, you know, schedule regular parent meetings so that the parents can be in the know about what's going on, and so that we can really provide parent-directed support to support behaviors still happening in the home. And then for all of our clients, we will always offer school support and collaboration. We will collaborate with other services such as OT, PT, you know, speech, all of that good stuff, because we want to make sure that we are, you know, communicating amongst the treatment team. Okay. But wait, there's more. So we have more awesome services that we offer. We have the Art of Friendship Social Skills program, which is our group program. We do have groups for other reasons outside of social skills, such as maybe we do have a group running right now for teenagers with depression. So we are expanding our group programs, but the bulk of our programs are around social skills, and that is for children ages 4 to 19. We work on a lot of social coping skills, impulse control, social anxiety, being able to take others' perspectives, frustration tolerance, and then also managing bullying or dealing with bullies. And this program is primarily geared towards children on the spectrum, but we also have, you know, neurotypical children as well, who just may struggle socially, or have other kind of social anxieties. And we cap our groups typically at 4 to 5, so they're a very small, you know, cohesive group, and no one really feels, you know, left out or left behind. And right now we're running that through teletherapy, and that's been going very well. We also offer a camp in the summer for 8 weeks. It's called Camp Pegasus. It is a camp for all different types of children, but it has a very kind of social coping based curriculum. So especially those kids that could benefit from the Art of Friendship Social Skills program, we might recommend Camp Pegasus for a really fun summer experience that also kind of incorporates those social coping skills. We talk a lot about theory of mind. So again, perspective taking, social cues, taking others' perspectives, flexibility, self-regulation. And that starts at age 6 through age 16. One of the requirements to begin Camp Pegasus is that the child should have completed kindergarten. So if your child's 6 but hasn't completed kindergarten, they wouldn't be eligible. And then last but not least, what we're doing right now, community education. We want to be in the community. We want to make sure our services are known about in the community, and we want to make sure that we're here for our communities so that we can provide these amazing services to as many kids as possible. And new as of last year, we developed an affordable care program. So that is led by 2 master's level art therapy interns, and that provides low fee services for families to make our services more accessible because we are out of network. So I just kind of wanted to plug that as well. And that's it.
Okay, well, I wanted to say thank you so much for Katie and Jerry, Mr. Jerry and Miss Selena for joining us tonight. We truly appreciate it. If anyone on the call has any questions and you want to send them in real quick on a chat while everyone is here, that would be fantastic.
Laurie, we do have one question.
Oh, okay.
Do you accept the waiver for art therapy services? That would be for Selena.
A waiver? What is a waiver?
If that person has, is there a certain type of waiver?
Can they give us more information, whoever asked the question?
No, the PFDS waiver.
Oh, I'm not sure. Not that I know of.
Okay, and I can put you in contact with the person who asked the question, and then they could probably give you some more information offline.
Great, and I can check with my supervisor as well.
Any other questions, Lauren?
None that have come through yet.
Okay. Well,
But
I
if
wonder-
anyone does have, oh, we do have another one. What is the best way to contact the Child and Family Arts Center?
That's a great question. So I think it's listed right here, the phone number, the main phone number, that will get you into contact with our main Haverford office. And then from there, intake coordinator kind of looks through the calls and then puts you in contact with a therapist that has availability. So I would start with the main number. Even if you just kind of search Child and Family Art Therapy Center, Haverford, it'll come up with our main number. If you call there, leave a voicemail. You can also go onto our website, childandfamilyarttherapycenter.com, and that will lead you to, you can kind of, I think it's under contact us, and you can fill out a form that kind of tells us what you're looking for. And then again, our intake coordinator will divvy it up to the appropriate therapist.
Great. And we will also be sending out this last slide as a PDF. So you'll have the art, music, and TheraPlay contact information. So everyone will get a copy of that.
That's in the handouts as well, I think, right?
It is, along with
Yeah.
the Act 48 form, if anyone does need that. And we will be sending both of those out in a follow-up email. So if you don't get them tonight, you will get them tomorrow.
Yeah. Okay, well, thank you for all of our families that attended tonight. Thank you.
I'm so sorry, one more question. They're coming in. Do either the Child and Family Arts Center or MusicWorks come to Bucks County at all?
So we don't travel to Bucks County, like we don't do in-home or kind of things like that. I guess I don't know what the closest location would be to Bucks County. Of
Probably
those.
Bluebell.
Yeah, Plymouth.
Yeah. I would say Bluebell.
Yeah.
When MusicWorks opened up their Montgomery County location, we specifically looked for a location close to Bucks County. And Blair Miller Road in Hatboro is 5 minutes away from Bucks County. So we get quite a few clients come from Bucks County for the sessions at the Hatboro Treatment Center.
Mhm.
Yeah, that's really close to our Horsham Center, which the same for us. We get a lot of families from Bucks County into Horsham.
Mm-hmm. And since both of you are offering teletherapy, that would make that easier for people coming as well, right?
Of course.
Absolutely.
Yeah. And even, when we do return back to in-person, as long as we are able to, we will continue to offer telehealth as an option, especially for those families that, aren't able to travel, as far as long as we are able to do that.
Great.
Awesome. Okay. Any more questions, Lauren?
Not as of yet, but I know as soon as you start talking, one will come up.
Okay, well, I did really want to say thank you to all of the families that attended tonight. Also, thank you to our panel of experts, Selena, Jerry, and Katie. We really appreciate your time tonight. As Lauren had mentioned, we do have the contact list as a handout, and we also have the Act 48 paperwork as well if you wanted to get credits for this. And lastly, we really would appreciate if you would take the time to fill out the survey. Let us know how this was, what other topics you'd like to see. We're here for you, and we want to provide whatever educational support that will help you through these challenging times that we're in right now. So, anybody else have anything they want to add before we sign off?
Just want to thank everybody for inviting MusicWorks. This has been wonderful.
Yeah,
Yeah.
absolutely.
Thank you
Yeah.
for inviting us as well. I really appreciate it.
Yeah, we all know it takes a village. And the significant part of the village is here, so we're here to support you. Thank you so much, and thank you for your time listening in tonight. All right,
Thank you.
everybody,
Thank you. Bye.
happy Wednesday night. Bye-bye.